Hi, everyone. I'm Susan Brown. I'm from originally Vermont, then I went to New Jersey, and then now I'm in Maryland. And I have been an advocate since 2007. I joined NPAF in Vermont. I had an amazing administrator that said, you know what, you're tenacious, you're driven. You need to go after these insurance companies because they're denying coverage. So that was the beginning of NPAF. Then I moved to New Jersey, and I worked for a very large cardiology practice, and then that's when the advocacy really kicked in, because I realized the burden that we carry as advocates. I thought it was my responsibility to start educating patients, not just on their rights, but also their responsibilities. So I was living in an over 55 community, and I wasn't 55 at the time, but my husband was. I started educating them because working in a cardiology practice, being a billing manager, I got to talk to the cranky patients that said, it's not my responsibility to let the insurance know that I don't have other insurance. And that's when I realized it's like, yeah, I really need to start education on these patients because they don't understand. Talk about the cost of health care, because what happens is the insurance company will pay all your claims up to one date and then jump over that date and start paying on the next claims. So you have to have your staff or yourself spend time arguing with these patients, getting them to understand how important it is to follow up and be responsible for holding that policy, because you don't want me coming into your house and going through your finances, your file cabinet, your drawers, to make sure that you don't have other insurance. So I can call the insurance company and say, no, Betty doesn't have insurance, other insurance, so yes, you have to pay the claim. But it isn't just that that's the cost of care. It's when we're all talking about the same story. You know, you're fighting with an insurance company to get an authorization. You're really not fighting with the insurance company. 95% of the time, you're talking to a vendor who has no interest in you, has no clue. When I look at these jobs, I'm looking for another job now that I'm in Maryland to see what I want to do, and they're saying, oh, you need to have this, this, and this, but when you go to apply for the job, no, you know too much and we don't want to hire you. And I'm okay with that, because coming here today has helped me realize what my next steps are, and every one of you has helped me get that, so stay tuned. God help NPF. You'll be on speed dial. The other thing that I do is I'm involved with mental health. I've got a couple of little certifications that are first aid mental health. So when I hear you share your stories today, I'm very passionate, because that's one of the things insurance companies like to brush under the carpet: cost of health care. If you dealt with the mental health issues, we wouldn't be dealing with a lot of the cardiology problems, a lot of the insomnias. I could go on and on what stress does to a patient because of mental health, and it then causes other problems. That's cost of health care. And also, when you're dealing with mental health, look at what it does to the judicial system. I'm so angry just thinking about what it does. So if we stop fighting and figuring things out and paying the providers who provide great mental health the way they should be reimbursed, like they do the specialists and the primary cares, that would also bring better providers into the system. I don't want to take up too much time, but everybody resonates, you know, self-care. We will get on a plane and we watch that little flight attendant, and she's like, okay, here's your emergency door. Next, when that mask drops down, put it on you, and then put it on your child. Take care of yourself first. I don't know why, it's just like, that was like ringing loud to me when I was preparing. You know, we listen to the Spirit, and I love how we all share the faith. But you got to take care of yourself, because you can't take care of the people that depend on you. Go for a walk, meditate, do yoga. Look at what's in your foods. Start making healthier choices. Take care of you, because you got so many people that love you and care about you, and so many people that depend on you. And you know what? This organization is a great organization, because I know they care about us, and that's why we bring our stories. They encourage us. And when we come here, it's like a refresher. It's like we're getting our flu shot. It's like our inoculation. It's just like we're here to share and to vent and to cry and to laugh. And I I could just go on and on. But thank you for hearing my story. You know, if the insurance company spent less time hiring vendors to say not to pay a claim and start paying a claim, just think of the millions of dollars that this United States of America would be saving. Thank you, everyone.